And now, Daktari, let us just look at now, probably if I'm with someone at home or someone is in the hospital, or I'm with this particular person in the car, and they experience a heart attack. How do they behave, or what are some of the things probably that they do, or just the behavior around this particular person for me to know that this is a heart attack?
Okay.
Yeah.
Heart attack is technically known as myocardial infarction. Once again, this would present with someone having a very severe pain in the center of the chest. This would be extremely severe, greater pain than they've ever experienced in their life, described by many as an elephant sitting on your chest, with a sense that something really bad is about to happen. This pain may or may not go to the angle of the jaw. It may go to the shoulder, to the left arm. Yeah. Usually these clients have what we know as a preamble or preceding signs and symptoms. This include pain in the center of the chest when you're active, you know, like when you try and walk quickly or climb stairs, walk up a hill, there's a bit of pain. There's also possibility of having shortness of breath when you're active. When you try and exercise, you get short of breath. You can't do what you used to do. Some people excuse this as saying, I'm actually getting older, or maybe I've gained a bit of weight. Yeah. But if that's happening to you, and especially if you're over 50, that's happening to you, or you're hypertensive or diabetic, or you smoke, or you're known to have high cholesterol, or there's a family history of heart attack or a stroke or kidney disease in your family, please come for a checkup. So that would happen. They can get dizzy. Yeah. They can also begin to faint. Yeah. When these signs happen, it means that first and foremost, we need to make them as comfortable as possible, loosen loose clothes, you know, let them lie, you know, supine or flat on the ground, and we get them to hospital, facing up preferably. Get them to hospital. As quickly as possible, get them to hospital. We need to receive them in hospital at least within an hour of the onset of these symptoms.
That's now for a heart attack.
Yes.
All right. And is there any other thing that probably someone can do? Let's say you're talking of within an hour. If is there like a first aid, probably things like resuscitation? We've had probably a number of people that experience a heart attack, people talking of we tried resuscitating. Is there like a first aid, like probably a CPR, something that I can do as I probably get this person to the hospital?
For heart attack on its own, usually CPR is not required.
Okay.
You just need to get them to hospital as quickly as you possibly can. For cardiac arrest, it's a different story because the patient actually faints or collapses in front of you. So we normally talk about first aid. There's actually sessions that are taught about first aid, which is actually very important. And always begin by clearing the way for breathing. That's called the airway. Clear the air. First of all, make sure that the airway is clear so they can actually breathe. Sometimes you want to tilt the head backwards so there's a free flow of air into their nose. Confirm that the chest is actually moving up and down, and then check the pulse. So that's ABCs, airway, breathing, circulation. The pulse should really be above 50. If you have a pulse above 50, then you're okay. Get them to hospital. If you cannot feel the pulse, or the pulse is very low, below 50, it may be necessary to begin what is known as cardiac compressions. So these are things that we teach, in first aid. So it's good to actually take some time and go for that. So we normally talk about chest compressions. So you use both heels of your arms and right in the middle of the chest. You're supposed to do about 15, then give space for breathing. 15, give space for breathing. If the patient isn't breathing, they've collapsed and not breathing, we normally talk about 2 rescue breaths. So 15 pumps with the heels of both arms with 2 rescue breaths, mouth-to-mouth resuscitation for someone who's collapsed. That's what's required for cardiac arrest. So this is very practical. We would strongly recommend that really everybody undergo first aid training because unfortunately, you know, you mentioned that cardiovascular disease is one of the leading, it's not one of the leading, it is the leading cause of death worldwide. Unfortunately, in our region, sub-Saharan Africa, we've caught up, because we are overweight, we do not exercise, we smoke a lot, take a lot of alcohol, and we're living longer, which is a blessing. But with living longer, these risks are coming upon a population more.
And you just mentioned over the compressions.
Yes.
I'm sure there's a way you do it, and there's can I say the period of time you take before doing the first, second. Like how exactly are you supposed to count for just someone that is at home and doesn't understand?
So 1,000, allow the chest to come back up. 2,000, allow the chest to come back up. 3,000, the chest to come back up. 4,000, allow the chest to come back up. Like that, up to 15. Then you stop, allow for rescue breaths. For instance, if the patient has no pulse, is not breathing, you do 15 with the chest recoil being allowed. Then 2 rescue breaths. The rescue breaths, you must, blow hard enough into the lungs, with the head, with the neck outstretched, to see the chest rise.
Okay.
Yeah, so this is it's not difficult, but the technique is, we require to teach you the technique so that you can save lives out there.
It's not just something that you can do.
These are the techniques I've given you. In general, that's a practical, but we strongly recommend that you do come in for training.
All right. And now let's just talk about prevention. You've mentioned that cardiovascular diseases are the leading causes of death. Yes. What can we do probably at an individual's level? What exactly can we do just to help in preventing people from dying actually from cardiac arrest and heart attack?
Primarily, this is lifestyle, because you mentioned the non-modifiable risk factors, which is your gender, your age, your race, and gender and your genetics. We can change that, but you can change whether or not you exercise. You can change how much salt you put in your food. You can change whether or not you smoke. Please stop smoking, because that's really going to give us less work and make our work more fulfilling. We can moderate the amount of alcohol you take. Adjust and cope with stress. Sleep more. Exercise more, and then watch your weight. These simple things, which are really within the purview of all of our lifestyles. Yeah, walk more. Let's use our cars less. Like today, I was late coming in for this interview because of so much traffic, much more than I thought I would actually encounter. Of course, when schools are open, cars are going to increase.
Exactly.
But when you can, see where you can park the car and take a walk to get to work.
All right. Any other thing that you want to add as far as the two are concerned?
So I would encourage that we all know our numbers. As our ages increase, please know your blood pressure. We encourage your blood pressure to be less than 130/80 if possible. If you do have another condition such as diabetics, let your blood pressure be 120/80 and less. We encourage you to make sure that your waistline, if you're a man, is less than 40 inches. If you're a lady, less than 35 inches. There's a technical words we talk about called body mass index, which is the composite of your weight and your height. So that we want a body mass index that's less than, if we can, less than 27. For all of us, really. It's actually useful to have that. Know your blood sugar. We want your blood sugar to be between the numbers of 4 and about 11, not more than that. We encourage that you actually do exercise 150 minutes a week. Yeah. All these numbers will actually help keep you healthy. We encourage 10,000 steps a day to prevent heart attack. But then if you actually want to control blood pressure, control your weight, make sure you live longer in life. Make sure you do at least 150 minutes a week of panting and sweating. Doesn't really matter what it is you do. Just make sure 150 minutes a week you do exercise.
All right, thank you so much, Dr. for that. That is Dr. Daniel Nduiga, cardiac and heart specialist right here, just helping us understand what a cardiac arrest is and a heart attack. We've also looked at actually a number of cardiovascular diseases, which, as Dr. puts it, are the leading causes of death in Kenya.